So you finally reached menopause. Welcome to my world. Menopause doesn't have to be the bugaboo that people think. I know you've heard about all these symptoms and maybe you're experiencing many of these yourself. Hot flashes, night sweats, fatigue, sometimes depression, anxiety, achiness in your muscles, joint pain. Because there's a lot of receptors for estrogen in your brain, sometimes you can even have difficulty with memory. In addition to that, your skin might be starting to get dry. And one of the most interesting prevalent complaints that I see with my patient population is hair loss. That's pretty important for women. What can you do about this? A lot of women are afraid to try hormone therapy. But all these symptoms are related from lack of hormones, particularly estrogen. Now, you probably heard some bad press about estrogen and hormone therapy as a whole. You may have even heard this from your own primary care doctor or your gynecologist. Let me assure you that the statistics that people are referring to are exaggerated. One of the big concerns about women is breast cancer. So let me just tell you what the study said that people are referring to in regards to being worried about an increase in breast cancer for those women who choose to use hormone therapy. Women's Health Initiative was published approximately 15 years ago. There were 3 groups of women representing 10,000 women per group. One that was not taking hormones, one that were taking progesterone and estrogen together, and one that was just taking estrogen alone. Unfortunately, the types of hormones that these women were taking were not natural hormones, and they were oral, which makes a big difference. Anyways, in regards to the breast cancer statistics, the group of women that were taking no hormones had 30 cases of breast cancer. The group of women who were taking progesterone and estrogen had 38 cases of breast cancer. And the group that was estrogen only had less than 30. Was not published in the original data, but showed up later and continued to show up in other published studies 10 years out, 8 years out, and so on. The results we have now, if they are reanalyzed based on people's ages, like the 50 to 60 age, 60 to 70, and so on, don't even show an increase in breast cancer. But at worst, if you were taking estrogen and progesterone, the risk of an increase of breast cancer that you would face would be an increased risk of 8 per 10,000 cases. I tell patients, that's less than 1 in 100, less than 1 in 1,000, 8 per 10,000. I think, quite frankly, that you would have more of a risk if a Martian spaceship abducted you than if you would get an increase in breast cancer from taking hormone replacement therapy. Prior to this study, several studies noted that you might even have a protective effect on breast cancer if you take hormone therapy. Specifically, what was seen in some research was that if women did have breast cancer develop when they were on hormone replacement, the cancer was smaller, the prognosis was better, and it was less likely to spread. It was easier to remove, easier to cure. I hope to convey a message to women that estrogen, it's a good hormone and it can make you live healthier and happier, particularly after menopause. Estrogen is good for your brain, your bones, your heart, your arteries, your skin, and your mood. I'm Dr. Laurie Marzell, certified menopause practitioner. More information about this very important issue is available on my website, drmarzell.com, And please feel free to sign up for our free newsletter. Studies are now showing that women have a 10-year opportunity from the start of menopause to get on some type of hormone therapy to prevent cardiovascular disease. Let's keep as healthy and youthful as long as possible. Thank you.